Hello, everyone, and welcome to Nursing to Do and to Be, your one stop shop for everything nursing. As I promised, today we're going to talk about the negotiable stroke risk factors. Negotiable stroke risk factors, in the sense that these are factors we can control or we can manage. Okay, so I have them classified as negotiable because we can negotiate. The first factor is unmanaged high blood pressure. When blood pressure is very high, it damages the walls of our blood vessels and puts us at risk for stroke. So it's important that when you notice your blood pressure is above normal range, to go seek medical care and get some medical intervention, or if you can do some treatment or therapy, whatever you need to do to bring that pressure down, because it's not healthy for your blood vessels. The next is heart disease. Heart diseases, it's kind of negotiable and non-negotiable depending on what kind of heart disease you have or one has. A heart disease like a damage due to our lifestyle choices, such as doing drugs to damage the valves of your heart. That is a lifestyle you can actually manage or manipulate. So that is negotiable, and that can actually cause you stroke or put you at risk, because when your valves within your heart are not working like it should, naturally we're born with valves in our hearts to close and open to let blood flow in and out of our heart. When those structures get damaged from illicit drug use, which is a topic on its own, that can cause our heart not to function right and put us at risk for stroke. Also, we do have heart diseases that could be due to smoke. As you all know, smoking takes out oxygen and replaces it with carbon monoxide, which is not a useful source of oxygen for our body to circulate around. And when the body is deprived of oxygen that it needs the most to function, especially in our brain where oxygen is very important, it makes us at risk for a disease called atrial fibrillation, which causes our heart to just quiver and not pump efficiently. When that happens, it makes you at risk for throwing a blood clot, which can block your vessels and lead to ischemic stroke. Okay, so smoking is a lifestyle, is a choice, and that can be modified based on the person's preference. So I have that as negotiable. The other thing too is that substances that people smoke contain nicotine, which in turn increases our heart rate. And for your body to compensate, your blood pressure goes up to match that increased heart rate, and that increases the pressure against the walls of your blood vessels and causes damage in the long run. The next one is birth control pills. According to research, when you take 100,000 women on birth control pills, 8 of them are at risk for stroke, in the sense that the high levels of estrogen and progesterone, which are hormones that are manipulated to prevent conception, put women at risk for coagulation inefficiencies. It throws our blood clotting system off and put it at risk for ischemic stroke or hemorrhagic, depending on the choice of the birth control pill. The next is history of TIAs. If you've had these warning signs, the mini strokes, and you've ignored it, it makes you at risk for a bigger stroke about to happen. And then high cholesterol lipid levels. If you have high cholesterol and it's not managed, the fat deposit could line up the vessels of your lumen and narrow the lumen, making less blood available to your brain. The deposits of fat, calcium lining the walls of our blood vessels limits the flow of blood to essential areas of our brain. And then we do have people who choose not to exercise. Sedentary lifestyle allow your blood to sit and clot, so then it puts you at risk for ischemic stroke. And we also have people who drink alcohol excessively. Alcohol actually increases your blood pressure, which will damage the walls of your arteries. These factors are negotiable, so it's up to you. Thank you for watching, and I'll be coming your way again next time with the non-negotiable risk factors. Thank you.